This is True Voice Unfiltered, the podcast where raw truth meets real transformation. I'm your host, Daria Anne, ghostwriter, content strategist, and holistic health warrior. No, I'm not a doctor, nurse, nutritionist, or any kind of medical professional, and this show does not dispense medical advice. I'm just an informed patient sharing what I've learned on my own healing journey. I also interview accomplished authors, speakers, entrepreneurs, and functional medicine practitioners who are transforming lives. If you're ready to break free from the sick care system, reclaim your health, and transform your life, you're in the right place. Let's get unfiltered. Hi, everybody, and welcome to True Voice Unfiltered, episode 28. This podcast is all about sharing truth, even when it makes us angry, even when it defies a narrative, even when it sounds unbelievable, which some of you may feel that way about the situation that we're going to talk about today. But believe me, if you take anything else away from this episode, I hope it's the realization that lawfare does exist, and we as citizens need to stand behind fellow citizens who are the victims of lawfare. So my guest today is Dr. Ron Elfenbein, who I first discovered when Dr. Mary Talley Bowden interviewed him. And Dr. Bowden is one of my heroes of the COVID era. She's still my hero. She's still fighting the good fight. And I saw her interview with Dr. Elfenbein back in December. Hard to believe that's already a couple of months ago. And I knew that I wanted to extend an invitation to Dr. Elfenbein to share his story on this podcast to hopefully reach a new audience and to generate more support, whether it's through a monetary donation, following him and sharing his story on social media, showing up in Annapolis. We're going to talk about that. There is a rally for Dr. Elfenbein this coming Thursday in Annapolis, Maryland, where he's from. But hopefully after you listen to this interview and you get to know him a little bit more, you'll understand why it's so important to support good people, good doctors like Dr. Elfenbein. So I'm going to go ahead and read his bio. It's quite a long one. And I also want you to understand his credentials and his legitimacy as a doctor. Dr. Ron Elfenbein is a graduate with high honors from Cornell University, winning multiple awards as an undergraduate. He then went on to graduate cum laude from SUNY Health Science Center at Syracuse with his MD. He was inducted into the National Medical Honor Society, AOA, during his third year and won numerous awards and honors while a student. He completed his residency training in emergency medicine at Johns Hopkins Hospital and served his final year as chief resident. Dr. Elfenbein received numerous accolades and honors throughout his tenure at Johns Hopkins and was awarded 2 federal STTR grants, the only resident in the program's history to even be awarded a national grant, totaling over $600,000 to do research for NASA on managing airway emergencies on the space station and space shuttle. He currently is the Maryland Director for Crime Care, is licensed in Maryland, Iowa, and Delaware, has privileges at multiple area hospitals, sits on the board of multiple medical-related companies, is a national speaker for a pharmaceutical company, is an advisor to many health-related companies, and is medical director to multiple ambulance companies across Maryland and Delaware. He has worked extensively with the United States Secret Service and has volunteered his time with numerous charities and government agencies. He has published and spoken extensively and is currently the president of Somerset County Medical Society, a position he's held since 2020. Dr. Elfenbein is a recognized and sought-after international speaker, was a recurring guest every Monday on CBS News during the pandemic, and has been featured on Fox News, Sky News International, Al Hurra TV, I hope I said that correctly, Newsmax TV, Breitbart Radio, and many others. He published an ebook entitled Surviving Coronavirus, an ER Doc's Perspective, which he gives away for free. Dr. Elfenbein was awarded a governor's citation from then Maryland Governor Larry Hogan for quote unquote leadership, commitment, and service. A citation from the Maryland General Assembly for quote unquote stepping up for your fellow Marylanders, being on the front lines fighting this pandemic, and for your honor, integrity, compassion, and vision. Your leadership and tireless efforts are appreciated. And was awarded the MEDSHI, I hope I'm saying that correctly, Maryland State Medical Society Distinguished Member Award, all for his work during the COVID pandemic. Dr. Elfenbein was the founder and medical director of First Call Medical Center in Gambrills, Maryland,
an urgent care that performed over 100,000 COVID tests during the pandemic. He set up and led a special team early on in the pandemic that went into area nursing homes and evaluated and tested residents and staff. Dr. Elfenbein developed and established multiple drive-up testing facilities in and around Anne Arundel and Prince George's counties in Maryland. He was awarded the contract to open an urgent care and testing facility inside BWI Thurgood Marshall Airport in Maryland. His became the only private practice in Maryland to offer the life-saving monoclonal antibody infusion for COVID treatment, and he very quickly became the state's busiest COVID monoclonal antibody treatment center, eventually expanding to 2 sites. Dr. Elfenbein was approached by the United States Government Department of Health and Human Services, HHS, to enter a partnership with them and the Maryland Department of Health to set up, run, and provide infusion services at FedEx Field in Landover, Maryland, which he did. Please help me welcome Dr. Ron Elfenbein. So, Dr. Ron Elfenbein, welcome to True Voice Unfiltered.
Thank you for having me.
Well, I am thrilled to have you join me. As I said in the introduction, I first saw you interviewed by Dr. Mary Talley Bowden, who's one of my heroes of the COVID era. And of course, you are now too, now that I discovered you.
Thank you.
To get into your whole story, I want to just ask you, tell us in your own words, what made you go into medicine and what was that journey like?
So, I've always been interested in science, and I really was very, very taken with science as a kid. The whole scientific method just fascinates me, and the whole process, and just learning about things. Always want to try to learn something new every day. And so I was very gung ho science to try to become a scientist. But to be honest, the practicality of being a scientist just didn't appeal to me. When I actually started doing some internships and things like that, I just didn't really, some people, and God bless them for doing it, will spend their entire career on one enzyme or one protein, and they learn all about it, and it really advances everybody's learning, and it's so important. But I couldn't do that. I'm more of a people person, and I don't say that to denigrate scientists by any way. I have utmost respect for them. I couldn't just do bench science. So I realized medicine was a pathway to be able to do both, take care of people and to be a scientist. So I thought it was wonderful. My father was an orthopedic surgeon, so I used to go on rounds with him and go to the hospital with him and stuff. And I just found it absolutely fascinating. And I love the interaction that he had with his patients and getting to know people and taking care of them and things like that. So I really liked it. And then when I was in college, I really had to buckle down and decide what I wanted to do because, by your second year in college, you really have to decide if you want to take the MCATs, the admission test for medical school and things like that. So I really sort of got pushed onto that pathway. I mean, I was still working in science in college. I was doing research and things, but I realized even more so that it just wasn't for me to do the bench stuff. So medicine allows you to be a scientist, but also a healer and a caregiver, and you could do more research is more clinical based, not necessarily bench based. So I found that to be more exciting personally. But again, nothing to denigrate anyone else who studies bench stuff. It's so important and so life changing.
So it's funny because my dad was a general and vascular surgeon, and I'm the youngest of 5 kids, and only one of us went into medicine, my brother Paul, and he decided he wanted to go into pathology. So everybody's different. And so, I mean, there's nothing wrong with that. I think everybody kind of needs to go where they feel they can best serve humanity. And I really feel like that's what medical professionals do.
Yeah. And you make a great point that there's so many different options within medicine. Like I'm an emergency room doctor, so I take care of people at their worst. I like it because it's exciting, it's fun, it keeps you on your toes. You really get to interact with a lot of different people, and not just your patients, but your staff and the EMS people and the family members and everybody else. You really get to all different scenarios, and I find that to be just very fulfilling. My wife's a pediatric oncologist. She takes care of kids with cancer, and she runs the bone marrow transplant program at Johns Hopkins. So she does a totally different type of environment that she works in and the patients that she takes care of. And, as you said, your brother's a pathologist, also equally important to the team, but a totally different type of practice. Radiologists, the same kind of thing. They don't necessarily interact with the patients, but they're so important and they're so crucial to making sure that we're taking good care of people. So everybody has their place in it. It really I find it to be, there are obviously these stereotypes about like this person becomes a general surgeon or this person becomes a and a lot of it's true, but not always. It tends to attract the same like-minded people. So it's really interesting how that happens. There's a lot of opportunity in medicine is really just for everybody who has, even like psychiatry, it's totally like not what you think of when most people think about medical care. It's more talking to people and they prescribe medicines too, but it's more like, not the traditional IV and IV medications and things like that, although sometimes it is. So my point is that there's just a whole breadth of opportunity in the medical field, and it's a very rewarding endeavor. And I think it's a vocation and an avocation. It's a calling, and people have to want to do it. You really have to want to be there, and you want to have to take care of people.
Absolutely. And I know that from my dad. As a little girl, I was always asking him questions. And I always felt so proud that, like, if we were in a public place, and this did happen a few times over the years, like if somebody had a heart attack or somebody fell, my dad was the first one to run over there, make sure they were, help them out until the ambulance could get there. And it just always was a source of pride for me. And I guess I just want to say that growing up around medical people, like everyone I knew was in it to help people. And of course, obviously, we all have to make a living. But I feel like doctors have been unfairly stereotyped, just from my own experiences growing up. And it's just very unfairly, I think.
100%. And we've been demonized by everybody, basically, because, I don't know a single doctor who has gone into medicine just to make a lot of money. I mean, if that was the case, you'd go into law, you'd go into business, you'd go into some other field. I mean, it's very time consuming. It's a long way to get there. It's a difficult path to get there. And I don't know anybody who practices medicine who does it just for the money. I would be very shocked about that, actually.
Or to hurt people, which brings us to your story.
Right.
Because let's take a little trip back now to 2020 when COVID hit. So walk us through that. And I mean, I read your bio, but I want you to tell the audience like what you did during that time and how much you helped people. And what's
Yeah.
going
Thanks for the questions. So I'm an emergency room doctor, but I started an urgent care center in 2016 because I have an entrepreneurial spirit. I've always wanted to be my own boss. So I started the center in 2016. It was kind of, piddling along, doing fine. I didn't actually work there clinically seeing patients. I would go there all the time and I would help out and do whatever, but I wasn't actually seeing patients. We had nurse practitioners and PAs that I hired that would see the patients, and I was the medical director. And, things were going okay. We had about 6 employees, excuse me, and life was good. And then in 2019, I kind of saw what was coming. People were saying, "Oh, you don't have to worry about it. It's not COVID-19. It's not going to come to the US. It's isolated to China." And I'm like, "There's no way that's isolated to China." They're literally boarding cities up in China. They were literally putting brick walls up to keep people in China and tanks at the. I'm like, "There's no way this is just in China. It's already in the United States. We just don't realize it yet." So I started doing what I could to gather supplies, and not just for the emergency room that I was working in, but actually I was working in multiple emergency rooms, but also for the urgent care. So we were gathering as much personal protective equipment as I could, and testing supplies. And then COVID hits, and because we had positioned ourselves that way, and because I take my oath incredibly seriously to first do no harm and to help people, we could have shut up. We could have shut the business down, and we could have just locked ourselves in like everybody else did. We could have just said, we're not it, but we didn't do that. We not only did we stay open, but we started sending people, myself included, into nursing homes. If you remember, very early on, the nursing homes were like a hotbed of mortality. Everybody was dying, and it was terrible. And then the government came in and said, well, you have to get tested every so often. But of course, they weren't providing tests, and they weren't providing the means to get tested. They just mandated everyone gets tested. Well, how the hell are you supposed to do that? So the federal government wasn't doing it, the state government wasn't doing it, and the county governments weren't doing it. So we decided to do it. So we formed these GO teams, and we started sending them into nursing homes to test all the residents so that they could isolate people who were positive and staff. We were doing it once a week to, I don't remember how many nursing homes. And then we started to donate our PPE supplies to other nursing homes and to other doctors. And I had friends of mine, or people I didn't even know, but example, a cardiology friend of mine who was drafted to work in the ICU in Manhattan. He's at Columbia. He's a cardiologist. And, they drafted him to work in the ICU because they didn't have enough people. And I'm not exaggerating. He was wearing a hefty bag as his gown. So I sent him boxes and boxes and boxes of PPE that I paid for. That was at my expense to ship it and all that stuff. And I was getting it to him, and all throughout the country. And even the DEA, the Drug Enforcement Administration, called me. It's called the SAC, the SAIC, Special Agent in Charge. He called me through a friend of mine. He lives here locally. I live in Annapolis. He lives nearby. And he asked me, he said, listen, we have a drug bust to make, which is a pretty big drug bust, but we can't because we can't get our hands on PPE. The federal government cannot provide us with PPE. Can you? And I absolutely. So I donated face shields and gowns and gloves and whatever else I could to the DEA so they could do their job. And they did their drug bust. And we developed these. I didn't develop it; an engineer did, but I helped to refine it. Was what's called an intubation box, which is basically like a Lexan box with a hole cut so you can put it over the patient when you go to intubate them. And if intubation is when you put a tube into somebody's lung so you can breathe for them. And initially the mantra was everybody should get intubated early. That turned out to be wrong, completely wrong. But that's what we were told to do very early on in the pandemic. So the problem is with intubation is basically you're putting someone to sleep and then you open their airway and all the virus particles become aerosolized, and it's very dangerous for everybody in the room. So the idea with this box is you put it over the patient and it gives the two little armholes that you can go in and you can do the procedure, and it's way safer for everybody in the room. So we developed this technology. Again, I mean, I'm not an engineer, but I had worked with someone help develop
Sure.
it. We refined it through testing, and then we produced them, and we were donating them throughout the country. I think 40 or something or 50 ERs, ICUs, offices, whatever. We would free of charge. We would donate them. We had a GoFundMe set up to raise money to do this. I didn't make a dime off of it. I didn't charge anybody anything. We were doing this out of the goodness of our heart to try to donate these things to keep people alive. I ended up writing a book about COVID, about how to stay safe and what to do, what not to do. I donated that for free. I'd never charged for it. But we just tried to do whatever we could to really help our community. Even basically, people couldn't get masks. We just said anyone who wants a mask, come by. We were asking the community to donate them, so people were donating to us. And then we had this ginormous supply. So we said, anyone who needs one, please come pick one up. Just no questions asked. You help yourself. So people were coming getting masks, and we were really trying to help the community as best we could. So we had one urgent care, and then we all of a sudden, because we were the only game in town really for testing, we started to become just overwhelmed with patients who wanted to get tested, and to the point literally where we sit on our urgent care sat on a major highway, and we opened at 8 in the morning. People would start lining up at 4 a.m.
Oh my
and the
goodness. Wow.
line was over a mile long onto this major highway. So we had to start hiring off-duty police officers at 3 o'clock in the morning to come in to run the traffic, because it was just
Sure.
too. Then we had to come up with all sorts of solutions. So then we started saying, well, we can't have all these people blocking this highway. So maybe we'll give them a card to come back at a certain time. I mean, we tried so many different things to try to keep this manageable. We were having fights break out in our parking lot. I mean, it was just, we had to
Wow.
hire staff just to keep the parking lot safe and moving. And I mean, it was just one thing after another after another. So we quickly grew from one site to 8 sites. And we even had a site at the airport, BWI Airport, Baltimore Washington International Airport. And we worked with the USO because BWI is one of the major points of embarkation for soldiers going overseas. The DoD, the Department of Defense, would tell the soldiers, "Hey, you're billeted to go to Turkey," and it was incumbent upon the soldiers to figure out, well, where do I get my test, and how good is the test for? Because every country had their
Jeez.
own rules. So it was like Turkey, you had to get it within 48 hours of landing there. Syria might be different. Israel was different. I mean, it
Crazy.
was
Yeah.
crazy. So we met with the USO people. We set up a whole schedule. We said, all right, we're going to just service you guys for these hours. In fact, we even went to their hotels a couple times, sent out teams to do that. We came up with a whole spreadsheet of like, if you're going to this country, then you need it. So we would tell them, you need it today or you need it tomorrow, come back tomorrow or whatever. So we would try to work with our soldiers to try to get them so that they could travel. And then, the monoclonal antibodies became a big thing. And I was a very, very early adopter of them. And I spoke out all the time on the news. I was on Fox News. I was on Breitbart. I was on Newsmax, CBS pretty much twice a week, talking about COVID and talking about the monoclonals particularly. And I started to question the vaccination for all mantra. It didn't make any sense to me logically. I didn't understand it. And I started to question that. I said, this doesn't really make sense. I don't understand why we're so gung ho. Everybody needs to be vaccinated. And we're, basically demonizing people who choose not to get vaccinated for whatever reason, right? It doesn't matter. And then I started to question, because this is the first time that at least as I know, in medical history, that DEI protocols started to make their way into medical decision making. And by that I mean we had these monoclonal antibodies, which were fine. The manufacturers were producing them, we were getting them. And by the way, just so your listeners understand, these represented the cure for COVID. They really were. They were just the absolute cure. And what it is it's an antibody that your body would produce to the virus given like 3 weeks, because we have billions of copies or trillions of copies that we could infuse into you in one infusion. You just put an IV in the arm, a bag of this stuff, it goes in, and it would take your body 3 weeks to develop that much immunity. We were giving it to you in one quick shot, basically. It takes about an hour, and there's really no side effects to it, and it basically cures people of COVID. Like, I
Oh
mean,
yeah, my brother, if I can interject, my brother and his wife and one of my nieces had them. I remember several years ago when they got COVID, and he said it was amazing. Like within 24 hours, they started to feel better. So I
yes.
know that they work really well.
Yes, it was unbelievable. I've never seen anything like it in medicine before. Truly, I really haven't. And so, I was an early adopter, and I said, I want to start doing this, and nobody else was doing it. So it was problematic in Maryland because it was hard. They made it very difficult. I can't speak to any other state, but they made it difficult because you had to go. If the doctor, if I saw you as a patient in my clinic, in my office, for example, in Maryland, okay, and I said you have COVID, I want to give you the monoclonal antibodies. I had to go to some third party website and fill out 3.5 pages of stuff, which would take me probably 30 to 45 minutes. Now, mind you, I'm not getting paid for this, and I have a waiting room full of people to see. And then I have to print it and then fax it to some number and then hope that they're going to call you. So I said, all right, nobody's using this stuff. We have this cure for COVID that nobody's embracing because it's so onerous. So I set up
Yeah.
a call center. I said, we're gonna take that away from people, and we're going to deal with all the paperwork and the nonsense. And I went to all the ERs and I went to all the primary care doctors and I said, here's our phone number. Once they test positive and you think that they're a good candidate, you have them call us. And I trained our staff. I gave them, a bunch of yes or no questions, the sheets. This is how you qualify somebody. And all of a sudden, we became the busiest monoclonal distributor in the state of Maryland, bigger than Johns Hopkins, bigger than University of Maryland. We grew from 1 to 3 sites. And again, we were doing it in 2 volunteer fire departments. So, no one had ever done this before. So we basically had to take their catering halls and convert them into infusion sites, bring in infusion chairs, bring
Wow.
in down, we were writing all this stuff as we went because it was just sort of make it up as you go. And I
Sure.
don't mean to say it was obviously based on scientific principles and good medical judgment and principles, but we had to kind of write the book as we went because no one had ever done this
Sure.
before. And then the feds approached me and they said, hey, you're pretty good at this. We want to open up a site at FedEx Field where the Washington Redskins, now the Washington Commanders, play football. And I said, yeah, sure. So they said, can you run it and you set it up for us and we'll run it in partnership with you, meaning me, the HHS, Department of Health and Human Services, and the Maryland Department of Health. And I said, absolutely. So they paid for everything. We opened up the site and I had to convince them that we should also test there. They were very much against that. But I said, well, if we test there also, we can then take somebody who tests positive while they're waiting in their car, give them the results and bring them right into the infusion chair and cure them. And
Yeah.
they were
Very
like, that's a
efficient.
great idea.
That's awesome.
Right.
Yeah.
So that became the national blueprint for the whole country, what we did at FedEx Field.
Incredible. Yeah.
And so I was talking about the DEI initiative. So for the first time in history, as far as I understand it, in medicine, the Biden administration took the monoclonals. Really, first they federalized it. Initially, it was basically the states would get their allocation from the manufacturers, no problem. There was no shortage. Everybody was happy. And the Fed said, well, we're going to take control of this. And then all of a sudden, they started to have, as you might predict, shortages
Yeah.
and problems. And then they said, well, we're going to send it not where it's needed most, but where it's most equitable. Now, I don't even really know what that means, but we've never done that before to any medicine in the history of the world. So why would you say, for example, Florida is a perfect example. They were having a massive outbreak. And rather than send Florida a higher volume of monoclonals because they needed it, they said, well, it's not equitable. So we got to send the same amount to Oklahoma or to Nebraska or whatever. No need. They didn't have an outbreak. Of course, they need some, but they don't
That
need as
makes
much
no
as
sense.
Florida. It makes no
Right.
sense.
Not at all. It should be for
So
sick people who need it.
Correct. It should be based on need. So I started speaking out about that. And then in December, the administration made a really catastrophic error and I called them out on it. They said that once it was an Omicron surge and they said once the Omicron variant reached a 70% prevalence, that the monoclonals that we were using were no longer effective against Omicron. And they were going to shut the program down once that 70% threshold was reached. Now, I argue that this was bad for multiple reasons. The biggest thing, you don't even know that that's the prevalence because there's no way to know because you're not measuring everybody. The US only measured like 2% of people for actual variant type, subvariant type. So you're looking at a terrible data set and there's no way to know that that's really what you're dealing with. But regardless, that's what they said. And indeed, they shut the program down mid-December of 2021. And I went on Fox News, I went on Newsmax, I went on a bunch of other right-leaning news programs. And I said, this is terrible. They don't understand what they're doing. They're misreading the data. And I said, people are going to die. And I don't know how many people are dead, dying, or will be dead or dying because of this terrible mistake. And every model that they've used so far, which is the truth, has been wrong about everything.
Right.
They're taking away people's ability for informed consent. I would argue if you're my patient and I say to you, listen, I have this medicine. I don't know what variant you have because nobody knows what variant you have. It's possible that you have Omicron, in which case it's not going to work. Or maybe it will work. I don't even know that. No one even presented any data that said it really is true that it doesn't work against Omicron. But even if it does or it doesn't, I'm going to give you the option, the patient, to take this medicine or not. That's called informed consent, letting the patient decide. And if you say no, that's totally fine. If you say yes, good, let's give it to you and maybe you'll get better, maybe you won't, but it's your choice. They took that away from
Right.
everybody. And we had to cancel, I think, 500 or 600 people. I can't remember who we had
Oh
scheduled
my
over the next 2
gosh.
weeks. Yeah, it was terrible. Turns out I was
Well,
right. Oh, go ahead. I'm sorry. You have a question?
I was just saying, instead of listening to an actual doctor who's in the field dealing with this every day, someone in the government decides based on what that it's not going to work. It's so frustrating.
And I'll send you the link to the Fox News article because when we're done, I think I called it like the height of bureaucratic arrogance, and I would use that term again.
Yeah,
And
totally.
I was
Great,
very
great way to
angry,
put it.
right?
Yeah.
Yeah, because that's what this is. And this is what got me in trouble when I went on the news and I publicly called them
Mhm.
out, and I would do it again because it's ruined my life. But I was right, and this is terrible, and I can guarantee you people died because of this, and or people got sick and had to go to the hospital because of this,
Yeah.
because of the stupidity and the arrogance of people who think they know better than everybody else and who take that away from the individual patients and their doctors. It's just
Right.
it's awful. Anyway, so only the government can make a mistake of this magnitude. So 2 weeks later, they said, "Oh yeah, we were mistaken." They never apologized, by the way. They never said we're sorry. They said we misread the data and we were off by a factor of 50%. The prevalence of Omicron was 20%, not 70%. Now again, only the government can make
Yeah.
like a
Consequences of
and
it.
not
And never, no
consequences.
consequences, never.
No, please.
It's
No, don't
infuriating.
apologize.
Yeah, it's
So
just,
I go
uh,
on the news. I call them out. I'm very angry. 2 weeks later, they admit this, and literally we had refrigerators stocked with this stuff, and people were calling me saying like, "Oh, my dad has cancer, my uncle's dying, whatever." Horrible, horrible horror stories. And I'm like, I can't do it. I'm sorry. I'm going to lose my medical license and I'll be shut down. I cannot do it. I apologized. We got a letter from the feds and from the state saying you can't stop the program, don't infuse anybody. So 2 weeks later, they allow the program to continue. So we got back up and running. We're infusing people. I'm very happy. I'm glad. And 4 months later, in April of 2022, with no warning, no phone call, no email, no text, nothing, I find out that I'm indicted on healthcare fraud charges. And the government really hadn't even
mhm.
done any real investigation. In fact, it was so bad that they got my name wrong on every piece of paperwork. They gave me a middle name, which I've never had a middle name. They got my first name wrong. They never interviewed any of my partners. And I'm a doctor. I'm the only medical in the clinics. I was the medical director. I'm the only physician, but I have two business partners. And they basically said that we were upcoding, charging more than we should have for our and I'll get into that in a minute.
Okay.
But you would think that they would want to speak to the business guys, the guys who actually run the business. That wasn't me. I was just there for the medical stuff, but they never did. They looked at my personal emails, my Yahoo emails, but they never looked at my business emails. And yeah, and it just
That's
even the judge in a pretrial hearing said, and I'm going to quote him, he said, "This looks like a case of quote, shoot first and ask questions later," end quote. And that's exactly what it was. The judge called it
wow.
out and he was 100% correct. And that's not the way things are supposed to work. If they Just so you know, when you submit a claim to an insurance company, be it Medicare or private insurance, all you submit is a bunch of numbers. There's no chart that goes along with that. So if they want to look at your charts to see if you're actually upcoding, which is the proper process, they have to request them. And they never requested the charts until after they indicted me. They never got the
Oh,
charts
geez.
until after they indicted me. And they only looked at three charts. Over that course of the indictment, we saw well over 100,000 patients. They only looked at three. Actually, end up being five, sorry. And they never even had a professional coder look at those five charts, just government attorneys, which is just insanity. And the way it's supposed to work is if they have a question, like I said, they're supposed to call you and say, and this is in their own guidebook, these are their own rules. They're supposed to ask for charts and do a chart audit. And then if there's problems, they're supposed to say, well, hey, we don't understand why you did this. Can you explain it? And at worst, this is just a billing dispute. We build what's called the level 4. There's basically a scale between 2 and 5 that you can bill for evaluation and management services. So anytime a doctor or nurse practitioner or PA sees a patient, you bill, it's called an E&M code, evaluation and management. And those fall between 2 and 5, 5 being really, really sick and 2 being not that sick. And there's this chart that the AMA puts out. It's a little confusing, but it's basically here. You can go through the chart. And when you go through it, you see what level lines up with what you're doing. So I put out a bunch of emails to our providers and I said, here's how I believe you should be billing. But, they were free to change it. I wasn't seeing these patients and they still came after me, even though I wasn't seeing these patients. And, again, at worst, it's just, okay, so we build a level 4. You think it should be a level 3. Okay, big freaking deal. Like, tell me I owe you some money back. Okay, fine. Well, let's have a discussion about this. Let's sit down like reasonable people. But that's not what they did. They never even gave me an opportunity to speak to them. They just hit me with a sledgehammer and destroyed my life and took my business away from me and ruined my family's life and completely just, and I believe that, and I think it's pretty clearly obvious that this was pure retribution for speaking
Oh,
truth to power. I mean, there's no other explanation for it.
oh, I believe
And
that too, 100%.
yeah, I mean, it's just, you know, so I took it to trial because I didn't do anything wrong. But the
Right.
government's very sneaky, and the government lawyers. Thank God the judges really pay attention. And my judge in particular, James Berdar, who was the chief judge of the state of Maryland, was the judge assigned to my case, and he was paying attention. And the government gets to go last, which is just mind-boggling. Like closing, like they're accusing you of a crime, you should get to go last, but they get to go last.
Exactly.
And they say, the lawyer gets up there and he says, you may be asking yourself, jurors, should it have been a level 4, level 3, a level 2? You don't need to know. It doesn't matter. The only thing you need to know is that Dr. Elfenbein is wrong and he's a criminal. And by the way, they never said during the trial what level we should have been billing, and they never said why level 4 was wrong. They just said I was wrong, but they never said why, and they never said what the right level was. And we had a coding expert. They didn't even have a coding expert. We hired a coding expert, and he went through hundreds of charts, and he said, yes, the coding was perfect and everything was right. And it wasn't just some random guy. He was the president of the American Association of Professional Coders. So he was like a very well-respected
Wow.
guy. They didn't even have a coder, and they didn't have a coder look at the charts. And then because everything that they had come at me with basically fell apart on cross-examination, their last argument was to the jury. And the prosecutor says, the defense is going to show you these charts and these rules, and they're just trying to confuse you. And you shouldn't be confused. Just use your common sense. Does your common sense tell you that they should have been billing a level 4? And if we had been able to rebut that, I would have said, well, have you ever filed your taxes? Because there's no common sense in any of this. You, the
No.
government, wrote these stupid rules that we were following. And now you're telling me we should have just abandoned the rules and use our common sense. You can't have it both ways.
Yeah.
Right. And the government wrote the rules that they now want us to abandon. So anyway, the jury found me
Weaponization of the law.
Yes. So the jury found me
Mm.
guilty.
Ugh.
But the
Wow.
judge, yeah, it was the worst day of my life. I've never had an experience like that before ever, and I hope to never have it again. And I hope, God forbid, none of your listeners ever experience anything like this, because it was just like, I've never been suicidal. I'm a very glass half full kind of guy. I'm very optimistic. I mean, I was facing 50 years in prison, and I was just totally crestfallen. I mean, I was thinking, like, I have 4 kids. I'm very close to them. I was like, I'm going to miss their birthdays. I'm going to miss their weddings. I'm going to miss their graduations. Like, this was just horrific. Anyway, long story short, the judge, the courageous, wonderful judge who was paying attention, wrote a 93-page opinion. And just to put that into perspective, the Supreme Court doesn't write 93-page opinions.
Yeah.
Completely obliterating the government's case and saying that there's no crime here. And he acquitted me. And he said, just in case the government appeals, you're guaranteed a new trial. And I just wanted to read a couple quotes, if that's okay with you, that
Please
he
do.
put
Yes.
in this opinion, because they're so powerful. He said, the court, having closely observed the testimony and parsed the evidence in this case, concludes that the evidence weighs so heavily against the verdict that it would be unjust to enter judgment. There can, of course, be no crimes if the defendant complied with those rules. Citizens cannot be held to criminal account for doing only what a technical regulation is reasonably read to permit. The government did not carry its burden, and no reasonable jury could have so concluded. I mean, it was 93 pages of this,
Yeah.
of just quote after quote after quote, of just completely destroying the government. And then on their way out the door, literally weeks before Trump gets inaugurated, the vindictive Biden DOJ decides to appeal. And now I'm being dragged back into court for another trial in August. And just to show you, like, how much this judge, like, is caring and agrees with that this is a bogus case. He was supposed to be the one who adjudicates the new trial. But we just got an email from him about 2.5 months ago that said, I'm recusing myself. And recusal is a very specific thing. You got to have reasons. I mean, you don't have to tell anybody, but you don't just recuse yourself. You could reschedule, but he recused himself. And the only reason I can think of that he would do that is because he feels so strongly that this case is a bunch of nonsense that
Yeah.
he doesn't feel like he can be objective to the government. So, and he's an Obama appointee, by the way. That judge was an Obama appointee. So even he, like, taking politics out of this, even he could see, like,
Sure.
how silly this case was. So yeah, it's been a roller coaster. It's been a nightmare. That when I found out I got acquitted, it was the best day of my life. I was just so happy. I for the first time in almost 3 years, I actually slept through the night. It was like
Yeah.
this weight was just completely lifted off of my head. It was incredible.
I just can't imagine what you've been through. I mean, here you were, like, spending your own time and money with the PPE and helping and rallying the community and doing all these things to help people during COVID. And it's like, this is the thanks you get. Like, just total.
Yeah, and to speak to that, not to pat myself on the back, but thank you for pointing that out. But, like, so the governor of our state, who at the time was Larry Hogan, gave me a personal citation, personally delivered it to me, thanking me for all the work I did during COVID. Our state legislature personally gave me a citation to thank me for the work during COVID. And even after I got indicted, the state medical society still named me its person of the year. And the federal government indicts me. That's the thanks I get. Yeah, I would have preferred a handshake or just a thank you. But
Yeah.
it's just the unfairness of it all. Like it was a very simple explanation for what we were doing. And all it would have taken was a phone call and just say, hey, could you come in and talk to us about this? And that's their own procedure that they're
Well,
supposed to follow, by the way. I'm sorry I'm getting angry, but like this just destroyed.
you have every
Yeah.
right to be angry. This is not done in good faith. This is totally bogus. I mean, it's, because you had the guts to go on Fox News, and I will put a link. I have that link you sent to me. I'm going to put everything in the show description. I even have a link to the PDF for the judges, the judges' comments that you just read, and the was it 93 pages? I'll link to that
Yeah.
too, because I want people to see this. People need to understand what's going on now. So when is this trial, Doctor? When's the
August.
August? Okay, and I
Yeah.
understand that is there a rally for you this coming Thursday at the Annapolis House?
Yes, there
Yeah.
is. So we're trying to really get someone in the Trump administration to just be objective. And that's all I want. I don't
Mm,
want any special treatment or whatever. I just want someone to take a step back and say, wait a minute. First of all, is this fair? Is this just? Because that's what the Department of Justice is supposed to be about. But then number two, is this a good use of taxpayer dollars? Because I can't
right,
tell you how many millions of dollars they've already wasted coming after me for a nonsensical case that even the federal judge said was a stupid case. He didn't use those terms, 93 pages of basically that. Don't you have anything better to do? Like, just put it
right,
into perspective. The Biden DOJ had all this stuff on Epstein for the last 4 years. They did nothing. And they came after me. Like, they didn't come after anybody about any of this, these horrible crimes, people like murdering and hurting little children, and they're coming after
right,
me. For at worst, is a billing dispute, which really, even if it's that, it should be a civil case, not a criminal case.
right.
So just to put this into perspective, I'm sorry I'm bouncing around a little bit here, but when the government brings um, accusation of a crime, they have to prove both elements, meaning they have to prove that there was a crime, that's called falsity, and they have to prove that you had the intent to commit a crime. So what did they use to prove my quote unquote intent? I sent emails to our providers, as I said before, explaining what E&M coding was. And I said in this emails, and I probably sent throughout the course of the pandemic, I don't know, 5,000 emails, I don't know, lots and lots and lots of emails. I was emailing all the time because that's the only way I could keep up with. We went from 6 to 300 employees. I had a lot of people to keep track of and things to, here's your
Yeah,
updates. So anyway, I put in these emails, E&M coding is the bread and butter of how we get paid. Now, that's not a nefarious statement. It's the truth. If you look at like
yeah,
how doctor offices bill, most doctors' offices, not surgeons, but most primary care and internists and urgent cares, 90+% of what they get paid comes from E&M coding. But they turned it into like the most nefarious thing in the world. They put it up there every chance they got. It was even in the indictment. Look, he's greedy. He's a criminal. Bread and butter, bread and butter, bread and butter. It's all they talked about. And I'm like, that's what you have? That's your evidence that I committed a crime? Seriously? That's what the government presented.
it's unbelievable.
Like,
Unreal.
unbelievable. And the
Unreal.
problem is they're the US government. So when they go
Right.
to a jury who was supposed to be a jury of your peers, but they're not my peers, and I don't say that to denigrate anybody, but there was no physicians or PAs or nurse
No,
practitioners or nurses on that jury. They look at that and then they put up my tax returns and they put up the business tax returns and they said, look how much money he made. Granted, I did okay, but the business went from seeing, I don't know, billing $800,000, maybe I'm making these numbers up, but whatever it was
sure.
in
Yeah,
the year before COVID to billing 20 million the year of COVID. Now that's what we billed. It's not what we got paid. And it's certainly not what we took home.
sure.
So regardless, we saw
But
over 100,000 people like,
shouldn't matter
but,
because you're helping people. You're actually doing something
and,
valuable.
and we have a right to get paid, but the
Yeah.
government seems to think you don't.
No.
That's what they use to convince people that
Uh,
like I committed a crime. It's just like I told you before, like I feel like when I'm telling people this, I have like a tin hat on my head and we're talking about aliens from outer space because I sound like a crazy person. But this is reality. This is what goes on. And the
yeah.
more I talk about this, the more I realize I'm not alone. There's a lot of people that go through similar situations to mine that just they weaponize this stuff against you and it's just the Department of Justice is just out of control.
Department of Injustice.
Yeah. And you want to hear something even crazier. So, and again, fact is stranger than fiction. They invited me, the DOJ invited me. I live in Annapolis. I'm about 40 minutes outside of DC. Invited me to their headquarters in DC to be part of a roundtable discussion about weaponization of the Department of Justice. So it was me and about 18 lawyers and one other person. And we're sitting there in front of this official from the DOJ talking about our stories. And the lawyers were talking about how to end weaponization. And these are the people coming after me.
Wait, when was this? Hold on. When did they invite you to do
This
this?
was
Was it?
3 weeks ago.
Are you kidding? You can't make
No,
this stuff up.
I'll send you
Seriously,
pictures. I'm a picture of me standing at the lectern
my
with the
God,
seal of the Department of Justice. Like you cannot. I had a badge. They had a badge. I mean, I had to get pre-cleared to go. Like it's crazy. You cannot make this stuff up.
you can't.
But and then they're trying to throw me in jail. And again, to go back to that. So the difference between a level 4, which is what we were billing, and a level 3 is about, it depends on the insurance company, but let's just say it's anywhere between 20 and $50. Let's say 50, high end. Okay. So if they're saying that those 5 counts that they charged me with, which were real patients, and by the way, most of the time when the government tries people for healthcare fraud, it's for made up patients or things that didn't actually happen. These
Yeah,
were all real people. In fact, the government called 3 of them and they all testified. Yes, I was seen. Yes, I got tested. Yes, they took my vital signs. Yes, I saw a provider. Like they were real people. This isn't like ghost patients. We were actually providing the service. So let's say the difference between a level 5 and a level 4, let's say $50. So 50 times 5 is $250. They are trying to throw me in jail over a dispute over $250 for 50 years. Like
just
it's
it's
mind-bogglingly crazy and stupid.
it really is. I just want to understand what this jury too, though, what they were thinking when they were hearing from your patients. Just like it's just I can't even
It's
comprehend it.
I'll tell you, like again, it's the government. So people believe the U.S. government when they think, well, if
Mm,
the U.S. government's bringing a case, they got to know what they're doing. If they're bringing this case, they have to have evidence.
wow.
We like I said, we had an expert, and the expert completely tore their case apart and said what he was doing was appropriate. In fact, he even said at one point, they asked him a question. He said, "Listen, Mr. You obviously don't like the rules, but these are the rules. Just because you don't like them doesn't make it wrong. And the fact that
Correct.
Dr.
Yeah.
Elfenbein followed the rules isn't a crime. That's what he's supposed to do." I mean, I'm paraphrasing, but that's what he said. But the jury still, I don't know. But that's why the judge even said no reasonable jury could have so concluded. Like I think the judge even called out the jury, which is so remarkable and so courageous of him to do that.
Yeah, absolutely. I mean,
And
kudos
and
to
and
him for being objective.
Yeah. The American Medical Association wrote an amicus brief on my behalf to the court, which is basically a friend of the court brief that said that the rules that the government and the AMA wrote, I didn't violate. The government is still coming after me. So the people who wrote the rules said he didn't violate the rules, but the government is still coming after me. Like, again, you cannot make this stuff up. It is just
Yeah, you can't.
mind-bogglingly crazy and stupid. But that's where I find myself. I mean, I don't know what to say. I just don't know what to say
Yeah. So
anymore.
so okay. So the new trial is coming up in August. So what can
Yes.
anybody do that's listening that is as outraged as I am right now and wants to help you?
Well, thank you for asking. So a couple things. I have a website. It's ronelfenbein.com, ronelfenbein.com. My story's there. Please follow me on Twitter or X. I have a Give Send
Still call it
Go.
Twitter too.
Twitter, I know everybody does. My Give Send Go is linked to on my website. I got to tell you, like, thank God my wife has had a job through this whole time. I
Yeah.
couldn't work for 2 years. I basically very hard to get back to work. I never lost my medical license, but every hospital that try to get privileges at looks at me askance and says, "Well, it's got to be something wrong here. We don't want to privilege you." And then even if they do privilege me, a lot of the insurance companies wouldn't give me malpractice insurance because they said, "Well, you haven't practiced in 2 years." So it's kind of a catch-22. So it was very hard to get back to work, but I've managed to a little bit get back to work. So I have a job, thank God, and my wife has a job, and we're not in danger of losing our house. But like this has been, I don't want to put numbers on it, but multiples of millions of dollars, which we didn't have. You would think if
Yeah.
reading the government's allegations, like I'm Tony Soprano and I have money hiding in like the air vents in my ceiling. Like I
Yeah.
drive a Hyundai and my wife drives a beat up Subaru. We literally drive like, old junky cars. We have 4 children. We live as frugally as we can. So this has been incredibly expensive. And then another trial is going to be even more expensive. So if people can afford or feel inclined to give, that would be really, really nice. I'd very much appreciate that. But my whole point in going public is because I sat quiet for almost 3 years and I realized it wasn't getting me anywhere. And I spoke to 2 doctors, both of whom had cases similar to mine, who got dropped. The circumstances were different, but it was just as much a bunch of nonsense. And I said, "What did you do? What was your secret sauce?" And they basically said they went public and they were as loud and as they could possibly be. So I said, "All right, well, I'm going to do that." And I've already testified at my own defense, by the way. Most defendants don't do that, but I did. I testified at my own trial because I didn't do anything wrong and I felt like it was the right thing to do. People can go to my website. They can follow me. They can help spread the word,
Mm.
please, because you never know who's going to hear this. You mentioned Mary Talley Bowden. So she had me on her podcast, I guess like 2 months ago, a month and a half ago. And literally like a week later, I get a phone call out of the blue. And the guy on the other end says, "Hi, Doc, this is United States Senator so-and-so. I saw your podcast. I saw you on the podcast with Mary Talley Bowden, and I was like, wow. And he was super nice. And he said, I really want to help you. This sounds crazy. And he had me in his office for like an hour with him and his staff. And he's like, send me more information. I don't know what's going to come of it, but he's been very helpful. And at least he's interested. Again, my point is you just never know who's listening and you never know who's
Exactly.
paying attention. So please spread the word, share the podcast, talk to your friends. And I think the most important take home message is yes, I'm some guy that this happened to, and it's a terrible story. And people should feel bad and all that. Yes, thank you. I get that. But like putting that aside, like I'm nobody, right? If they did this to the president of the United States, why would they not do it to you? Why would they not do it to me? Like that is what should outrage everybody. The fact
Yeah.
that they did it to me, yes, okay, I'm a father of four, I'm a nice guy, all that stuff, that should make you feel bad. But beyond that, it should be that, oh my God, these people can destroy people's lives just at a whim and
Yeah.
because they don't like what you have to say. That is the most un-American thing imaginable.
Exactly.
And it is just so egregious and so horrible. And again, it could be anybody. So, you know, that's why we have to stand up, not just because it's me, but because it could be you.
Oh, hey, listen, yeah, and after what we've been through the government over the past 6 years, I mean, just getting back to what you were saying, when you were talking about the monoclonal antibodies and just how cumbersome the whole system was to have to enter all that, it made me think of theirs. They make it as
Oh,
difficult as possible to report an injury. And I don't know if I want to use the word because this is going to go on YouTube and I don't want it to get banned, but the intervention, if anybody had a reaction to it,
yeah.
they made it so hard and it took so much time and so cumbersome that what's the statistic, like less than 1%, that only represents like less than 1% of all injuries from the
Yes.
intervention that they tried to shove down everybody's throat. And and just so just like what you're saying about informed consent. So anyone who still trusts the government after everything that's happened over the last 6 years, I mean, I don't know, I envy that kind of faith, I
Blind
guess, and
trust.
belief in yeah,
Yeah.
I mean,
Yeah.
seriously, because no, and this should terrify everybody what's happening to you, like you said. So I will put all the links to everything in the show notes, including the judge's ruling, because I think everybody should read that. And that's going to be in there. And I have a link to the Fox News article. And I just encourage everyone, even if it's $5, like just donate to your Give, Send, Go, because as citizens, we have to band together against this. I mean, it's the only way any of this is ever going to stop.
Thank you. Yeah,
Yeah.
and actually, your original question was about the rally. So we're hosting a rally on Thursday at the Annapolis State House at 9:45 in the morning. I have a filmmaker coming in from on his own dime, which is just so nice of him
Oh,
to
wow.
make
That's
a
awesome.
film about all this and to talk about what's happened and the injustice of it all. And he's going to be filming the rally and stuff. So we're trying to do that at the steps of the Capitol building in Annapolis at 9:45. Yeah, I'm excited
Great. Well,
about that.
anyone else, anybody listening who's in that area, please go. Please go out and show your support. And hopefully it won't
Yes.
snow that day. You guys didn't get a lot of snow, so that's good.
No, thank God. Yeah, we just a little bit, but my kids did the school did get canceled.
Yeah.
But just to put this to perspective for people, like, because you can't really understand what it's like to go through something like this, but I kind of use like the badness scale, if you will, like and I put the top of the badness scale, a family member dying, and what happened to me is just below that. Like
Yeah.
I was a wreck of a human being for 3 years. I my family was a wreck. My kids, like they're all well adjusted, straight A students. Three of them had to go into therapy. One of them wouldn't leave my bed for over a year. I sat there staring at the ceiling and she slept next to me because she couldn't bear not being near me.
Yeah.
I mean, this kind of stuff just destroys people, destroys marriages. Thank God my marriage didn't get destroyed. My wife's wonderful and we're very close, but you can't describe it to people unless you've been through it. It's just an awful experience. And I hope nobody in you listening ever goes through something like this.
I can tell you, in a way, I can relate because my dad was in private practice many years ago, and it wasn't the government suing him, but he was the target, him, the hospital, a whole bunch of people of this really malicious lawsuit where theoretically the patient should have died. He fell 500 feet from a scaffold. He was grossly overweight, all kinds of internal injuries. I mean, it was a miracle he was alive when he got to the hospital. And I was about 10 or 11 years old, and that trial was so stressful. It was the first time in my life I ever saw my dad cry. So even though it wasn't the government, just the whole system back then, I mean, it just made it so difficult for good doctors to practice. And, meanwhile, he still had to see patients. He's still and
Right.
wondering, oh, is this one going to sue me? Is this the next one? And so I can kind of understand, I can understand in a way, even though it wasn't the government, it really hit me that was, and actually my own sister ended up going into becoming a lawyer to defend doctors because she was so moved by that whole experience. So, but when it's the government, I mean, that's just a whole other level of stress.
Yeah. And it really hit me when I had to pay my taxes because I'm like, I don't, I'm like, not only are you trying to throw me in prison and destroy my life, but now I have to pay you. Like
Yeah.
that was just it was just like adding insult to injury. Like, here, give me another
Yeah.
paper cut. Like it was
Sure.
just like, come on. So yeah, it was really, really awful. And but yeah, I mean, being sued as a malpractice is awful too. Like any of this stuff is terrible. But at least that's a civil case. You're not facing
Right.
jail time. You're
Exactly.
not facing like,
Yeah.
I mean, I would have
Yeah.
lost my medical license. All this stuff would have happened. I for something that is so just on its face silly. And there's no other
Yeah.
way to put it. It's just so silly.
Yeah. I still, for me, just as I still can't even imagine this jury, like what they were looking at through this whole thing. But that just goes
Yeah.
to show you that people put way too much trust in the government, and it's time to start questioning things. And like I said, for citizens to rally around good citizens who are being unfairly targeted. I mean, this is lawfare. This is exactly what it is. They've weaponized the law against you, and it's time to take a stand. So I would encourage everyone. I will put all the links in the show description. Is there anything else you want to share, Doctor, before we end the interview?
If you know someone in like the Trump administration, if you can make a call, that would be great. If anybody who's listening, like anybody, please just, again, you never know where this stuff will go. So anybody you think can help. And I'm not asking for favoritism. I'm not asking for special treatment, just an objective eye, somebody to look at this and be like, okay, first of all, on its face, does this make sense? And second of all, like, again, is this just a good use of taxpayer dollars? Like, should we be doing this? Like, it's just, and
Somebody at the Department of Justice now could throw this whole thing out.
yes, and that's what I'm hoping
They
to
have the
find. That
power.
one
Okay.
person that can get to Pam Bondi or get to Todd Blanche, the Deputy Attorney General, or get to the President and just say, look, give him 5 minutes, just look at this. But yeah, someone in the Department of Justice could throw this whole thing out. And clearly, by the way, there's people at the Department of Justice who believe that this is bogus because they invited me there to speak about weaponization. Like,
That's so
you
crazy.
know, I know, and being there was just like a mind trip. I'm like, oh my God,
Oh,
is like,
no.
did I just smoke something funny? Like, where the hell am I? I'm crazy. But yeah, that's where I was,
Well,
and they were very nice and they were very open and they wanted to hear what I had to say. But it was just a totally weird vibe. I'll send you a picture. I'll send you the picture of myself with the lectern. Actually, it was myself and Governor Rod Blagojevich from Illinois. He was the governor that was apparently supposedly sold Obama's seat and was spent
oh,
8 years
yeah.
in jail, and then Trump pardoned him. So it was me and him were the only two non-lawyers at this roundtable discussion. I'm not really sure why he was there, but he was very nice too.
Yeah.
Anyway, it was just strange.
Yeah.
Yeah,
Wow.
the whole thing is strange.
Yeah. Well, I really hope, and well, I hope the senator can do something for you too. But I encourage everyone listening to please, if you do know somebody at the Department of Justice or in this administration, please use whatever influence you have. And hopefully, the more podcasts you do, the more you keep putting yourself out there, that it'll lead to good results.
Yes, thank
You
you.
know?
For someone in the senator's office or a congressman's office, reach out to them too. If you have a
Yeah.
good relationship with someone, please.
Yeah.
I'm happy to talk to anybody who will talk to me.
Great idea.
Yeah, thank you. I just realized you got to fight for yourself and you got to fight for what's right. And,
Yeah.
so thank you so much for having me. This
Really
was
do.
really great.
Well, thank you so much for joining me. I'm so glad. I mean, like I said, I saw Dr. Mary Talley Bowden's interview with you, and I said, oh my gosh, I have to get him on because I really want to talk about this and do whatever I can to help. I mean, my audience is small, but you just never know who might see it. And I'm growing.
Right.
So, I'll just
And
keep
hopefully it'll
putting
grow
it
your
out
audience
there.
too.
Yeah,
Yeah. Yeah.
absolutely. Well, best of luck to you. Keep me posted because I'd love to have you back on, as any updates happen, and hopefully you'll never go to trial. I hope the whole thing gets thrown out. That's my greatest wish for you.
Thank you. Me too.
And, thanks for all you do too. I mean, you're just such a, wonderful doctor and the perfect example of following the Hippocratic Oath. And I'm just really sorry that this is happening to you.
Thank you. I
But
appreciate that. Thank you. It's funny. I'm sorry, real quick. I just,
sure,
I was
yeah.
talking to my wife last night and she said, this is just to give you an example of how the government like does twists things. I was I was replaying an old podcast and I mentioned the fact that these monoclonal antibodies, we had to cancel all those people. And my wife looks at me and she says, do you think the government would use that against you? I'm like, how would they use that against me? She said, in your new trial, they would say, well, look, he had to cancel these people. He was just worried about making money. But that's what they do.
It's
That's what they do.
twisted.
They would twist that. Like I said during
Mhm.
trial, I said to my wife, I turned to her, I'm like, I could have just cured cancer. And they would be like, yes, he cured cancer because he can make millions of dollars. He's
Yeah.
greedy. But that's
Yeah.
just, they just twist everything. It's amazing. But
Yeah.
that's what they do. So anyway, I wanted to make that point because it's don't believe people like just because the government puts out the press release that says so and so is guilty of this, don't believe it. It's not necessarily true. Sometimes it is, of course, but you got to do your own digging and you got to let the facts play out
Absolutely.
because a lot of times, like in my case and lots of other cases I know about, it is total BS.
You've got to do your own research, 100%. Don't take anything at face value. That's
Right.
one thing I have learned, especially over the past 6 years. So crazy. Well,
Yes.
Dr. Elfenbein, thank you so much for joining me. Best of luck to you. Please keep me posted, and I'm going to share this interview far and wide and rally as much support as I can for you.
Thank you. I really appreciate it. Thanks so much.
Take care.
Yeah. Have a good day.
Hi, I'm Dr. Liz. I just want to tell you how amazing and easy it was to work with Daria on my book. You see, I've had a book for a while, been sitting on my desk, sitting on my computer. Maybe you might be able to relate to that. And I didn't know what to do, how to take it to the next step, how to make it look polished and edited and easy and useful for my readers. Met with Daria. We had some great conversations. She learned my voice, my goal, my style, and she was able to edit and give me feedback on how to make my message clearer, more focused, polished, and it worked. I have a book. In fact, I have a book and a workbook that she's edited for me and guided me along the pathway. So if you're maybe a little bit like me, that you have a book or you have an idea and you haven't known where to take it, how to take it to the next stage, reach out to Daria. She's a game changer and she's really easy to work with and takes great pride in her work as well. So join me in the published author arena. Reach out to Daria. I'm Dr. Liz.